treatment setting and transitioning back to their respective rural areas. So that's our question we're starting with anyway. And we all decided last night that the goal of our presentation was to get feedback from you guys. So we are excited for that part. So our Gantt chart, kind of our initial process was really gathering information from 3 different counties. And I think maybe we might have too big of an area, but our idea is to kind of compare and contrast between an Iowa county and some South Dakota counties and kind of see what we got. So we've started with interviews from the different counties, and you kind of see on the what's happening column there that we have emails out to the director and program manager of the inpatient program in Woodbury County, Jackson Recovery Centers. Haven't heard back from them. We're struggling to kind of get an answer from them. So we might have to pick up the phone and call them instead of have the email out there is maybe what we're looking at that in that regard. And that's kind of another barrier we're fighting against too. We're trying, Jesse had tried to contact the Division of Behavioral Health to release some statistics to us, and we're not getting those raw data. So feedback on that would be great as well. Let's see. One of the reasons we chose the transitional area was because, probably about 2 years ago, there was a place called Chad's House in Sioux City, and that was an adolescent halfway house for people who are leaving an inpatient program. But that really basically it failed because we couldn't keep it full and we couldn't keep the funding source coming to us in that area. So now it's actually an adult halfway house now. So we wanted to try to target that demographic in that maybe schools can help that transition, because a lot of times parents wouldn't want their kids going to the Chad's house, or the kid itself wouldn't want to go, and probation would say, hey, let's go back to the home environment. And the home environment was where a lot of times they really struggled in long-term sobriety and things of that nature. So that's kind of where we're at. And Jessie is going to kind of talk next about where she's at and what she's been finding in talking to her key informants. So Jessie?
Okay. So I've had a conference call with the Division of Behavioral Health that's here in South Dakota, and they are kind of the gatekeepers, the overseers of what we do for treatment services here. And I've kind of hit a roadblock with them of not wanting to release data because it's not for public consumption, is kind of what they're telling us. So I have convinced them to give us some, so we'll kind of, when basically what we're looking at is length of stay and who's in treatment and kind of some demographics of the basic, adolescents that are going back to these homes, and how can we utilize what's already in place in schools, either through school counselors, through other agencies that are available that can come into the schools, including community mental health centers, probation officers, to wrap all those services around the kids when they're there and they've got them. Because we have kids that are going from the most restrictive settings, both in South Dakota and in Iowa, as an inpatient treatment center, that are then going home, which in turn is the least restrictive that there is available. And these kids tend to flounder because they go from very, very, very much structure to nothing. And so how can we increase that structure and really help them succeed? Some of the things that we hope to get and look at is those Medicaid dollars and how they're funding and where else can that go to, and just kind of the length of stay in the county breakdowns. We've kind of picked a couple really rural counties in hopes of figuring out, what we can utilize there versus those that have maybe bigger areas and have access to some of those different things that these rural areas don't. I think that was what I was going to share. Kimber?
Yeah, so kind of what we've already said is we've really been struggling with the data collection, just because, first of all, these are adolescents, so people are not readily willing to share that information. also looking from the county with some of like the national job board or boards for data collection, that kind of stuff. We just can't find it. So I don't, I think we're beginning to question if we've gone too narrow off this from the get-go. Now, Maggie had done some key informant interviews that were really insightful and not necessarily went along with what we had as our question, but kind of talked about, there was some themes of having more mental health providers in schools, seeing that would be beneficial for these co-occurring issues, as well as having resource officers. Dakota Valley, I believe the school district was, does have a resource officer, and they kind of explored some of that information also. But yeah, right now we're still just kind of struggling with getting our hands on data and really focusing in on that missing that Josh talked about. So if you guys have feedback for that, that'd be great.
Jessica, did you want to talk about the interviews that you did and the information that you gathered for us?
Yeah. And if I could, I'd like to show you guys the email. I'd like to share it on the screen of the email that I'll be representing, because there's some numbers that you probably don't just want to hear about it, because it'll go in one ear out the other. It does for me, at least, when I hear numbers. Okay, are you guys able to see that?
Looks good.
Okay, so this is one of my key informants. Brittany is a children's, adolescent, youth and family services, or I should say she's a youth and family services counselor over in our children's department at Lewis and Clark. And I kind of threw her all our questions as well, and I told her to just adjust to it. So of course, this is kind of the opposite from the outpatient point of view, because I wanted to actually see how many adolescents she would get as far as a referral from the inpatient as they were coming out. So as you can see, you can probably see the MRT, FFT, and all that stuff. So here is what that all stands for. So I'll just give you like 30 seconds to look at that.
It's your 2-minute warning.
Okay. So you can see she identified that she sees the ages 5 to 18. She did mention court-ordered adolescents she does see, and then placements also for the JDC. Going into this interview and with the questions and what that I sent her, I thought I would get a lot of insight into what she sees as far as in the schooling, what they offer as far as, because like when we have issues with the schools for the children, they will actually reach out to Lewis and Clark and say, hey, we had this incident. Do you have somebody that can go to the home and check on this kid? We had to send them home, but they committed to safety. We just need a follow-up. So she kind of actually gave an opposite site to where, you know, in these counties, it's Lewis and Clark, you know. I did ask her verbally for the kiddos that are co-occurring, you know, it's either, well, it would have been HSC, you know, when they had the adolescent program that was out there for co-occurring. But now they're having to go all the way across South Dakota, or, you know, even before we talked about the evals being an issue with the group that presented before us, you know, that can also be an issue as well. So unfortunately, she was relocated to Yankton recently, which I was not aware that was a process when I gave her these questions. So as you can see, she sees a couple in Elk Point, Dakota Valley, Galo, that kind of area as well. So
we did also have, Jessica brought that up, and I know one of Maggie's key informant interviews brought it up too, just kind of the frustration of, especially like in North Sioux, if there has to be like a court committal or somebody needs to seek treatment, instead of going 10 minutes across the border, they've got to go over an hour to Sioux Falls or something like that, which creates a hardship for these adolescents' families who want to visit but maybe don't have the means to travel over an hour for a 20-minute visit with somebody. So just kind of that missing also, that had surfaced.
Okay, you all are out of time. Good use of it, though. Feedback, questions for this group?
I kind of just had a comment because my roommate actually worked at Chad's house when it was still an adolescent. And, you know, he said one of the main problems that he saw while working there was that, you know, these kids would go home like on a home pass, and then that's when they would reuse or relapse. And it's because they don't have, you know, a lot of family support either. And, you know, the family wasn't supporting them trying to stay clean and trying to stay sober.
Well, that's something. Can you hear me? This is Maggie, by the way. Can you hear me?
Yep.
Yep, we can all hear you.
That was something that Derek had talked about as well. He's the resource officer from North Sioux, about the problems with families that everybody was so gung-ho about. We need to enforce these rules. We need to do all this jazz. But then if it was their child that got in trouble, it was everybody else's fault. So then the family support goes to blaming everyone else. So then the actual situation's overlooked of what needs to be done to actually help this individual. That's all I had to add in.
Josh, can you share your screen again and put up the page that had the question on it?
I guess I have a question because I know in a future or in another conversation I thought that someone said like you could go from Nebraska to Yankton to utilize services. So South Dakota, you can't come into other states to utilize services?
Not readily, and not if you're using South Dakota Medicaid or contract dollars to pay for those services. You can't.
So are you guys focusing on South Dakota or which? Because I know you said you were kind of going back and forth.
We actually decided to look at Woodbury County as well as the county right across the border in South Dakota, because I think there's a lot of tri-state area issues because of where we're located, that if we could figure out kind of what the avenue is for both places and how they could maybe work together better is kind of one of our thoughts and along those lines.
I really love that thought, especially, I mean, I just have a general philosophical bias that way anyway, because I think it makes sense. But for the purposes of this project and understanding administrative rules and systems involved, I think I would consider choosing one state. You know, how do you work within their system, or how do you change their system to allow for reciprocity? Or, you know, I think you're going to need to start with one to push for another. Does that make sense? Otherwise, it's going to be too hard to focus. You know, is there a process within South Dakota? Is there a process within Iowa that has been used in the past? Perhaps, you know, we look at like compacts to place foster kids. We look at tri-state compacts to do other things. Is there a model that could be useful that they've exercised in the past? I guess I'm kind of talking my way back into a tri-state perspective. I mean, that would be one way to do it. But the other would be really, you know, targeting it that we want these young people from South Dakota to be able to access these services in Sioux City or vice versa. That just makes so much sense. But anyway, you all have to figure out what you want to do with that.
I think too, adding on to Julia's thought about honing in on one state, when we had talked about like our hospice geographical area, I mean, we really are in that tri-state area, but it's guidelines from state to state, and Medicaid funding and all of that varies so differently that it really makes things that much more complex. So just taking that complexity out of it and making it a little bit more simple would be beneficial.
Yeah, for the purpose of this class, of course, we could talk for a really long time beyond the 5 minutes left for your group about how this whole thing is so freaking stupid, right? And how we should have universal health care to cover stuff like this, because how much time and energy is spent trying to get some kid help they need when they live a mile across the border, right? Anyway, I'll get off my soapbox, but that's the super macro place where we can't do that here.
I do have a question for this group. I noticed in your question, you're really talking about the schools providing support to these teenagers. Did you guys do any research on like the local schools and the counselors that they do have, if they have background in co-occurring disorders?
I know Maggie interviewed a few people, but we didn't really ask, I guess, that credentialing question, but that would be interesting, because, it could simply mean that, maybe we need to provide maybe an educational sort of intervention to schools and, inform them what to look for someone who has a co-occurring disorder and is struggling with addiction and what kind of structure they're looking for and, what kind of maybe after school programs they would, best be suited for and things like that. So that would be a great question to add to our questions.
Would students who have those issues qualify for IEPs or other adjusted support plans? I don't know.
Unless there is a behavioral problem.
Well,
In South Dakota, they do.
Can I do that? Am I being heard or not so much, maybe?
Yes, we can hear you, Christy.
Okay, can I chime in on this one a little bit? Josh, the guidance counselors that normally work in schools, they are not certified as we are or will be as a licensed social worker. They just hold a school counseling degree in most cases. Now, there's some new initiatives in the state of Iowa, primarily in Storm Lake and in the Des Moines area, where they do employ licensed social workers within the system, and they're looking at early intervention pieces for kids. But at Storm Lake, they're addressing that all the way up. They just hired a K through 12, actually a licensed social work therapist that provides and Medicaid bills out of the school. That's a new initiative for that system, that district there that I'm aware of. But normally, guidance counselors, if you go to the Department of Ed, the regs on the BOEE, it'll show you that adding an endorsement for a guidance counselor is really just a guidance counseling degree, and that's all it is. They do not have the training in the background to be able to do therapy with children. Mm-mm. They don't.
Well, sorry, Christy.
Go ahead.
The key informant that we had from West High has a drug and alcohol background, and so she works with just at-risk students. And then everyone that we interviewed that we had discussed about what would they like to be changed, kind of that miracle question. And a lot of them, actually most of them, suggested more, clinical therapists in the schools to offer those support services for kids. But a lack of funding really prevents that option from moving forward.
Can I tell you how much I love that you all use the miracle question? I think that is one of the least used and most handy questions for this work. Okay, we've got a minute and a half left for this group. Any other questions or feedback for them?
Well, I don't know if this helps you guys out, but since I do work with youth risk teens, they're not allowing our therapists anymore to go into school and utilize school time. It has to be on their own time.
Okay, anything else?
I had a question. Does anybody know how to access some data on these individuals, or any ideas for some avenues we could try?
I have some thoughts about that. And I think what you might have to do is go with national or state level data and back up, if it's true that the literature shows that this is the rate of young people with co-occurring disorders based on the number of students in this area, we could anticipate there'd be at least this many. I mean, it's not great. But if you can't get, like if Jesse can't get the state to let it go, or if you're, running into roadblocks, I think you say, first of all, you say that in your paper, okay, we tried this and we tried this and we tried that and that didn't work. And so based on the best information we have available, this is our estimate. Does that help? It's not sad. It's not great, but it might be the best you can do.
Thank you.
Mm-hmm. Okay, nice.